Hi there, my name is Lucy Kemp and I'm going to be talking you through the selective mutism training today. So, our aims are to understand what selective mutism actually is and to understand the effect it has on a child. We also want to understand what the maintaining and contributing factors are to selective mutism and to learn about strategies used to support children with this difficulty as well. Typically, selective mutism is reported around age 3 to 5 years. It's possible that it could be earlier, but generally it's only noticed as a difficulty when a child starts nursery, which is often around 3. And so usually it's only reported onset at this point. Any later onset is usually linked to bullying. We find that more girls than boys are affected. It affects 1 in 140 young people and 1 in 2,400 adults. It's 4 times more common in bilingual families and 2 to 3 times more likely for a child to have speech and language difficulties with this difficulty as well. According to the DSM-5, which is the criteria we use for diagnosis, selective mutism comes under an anxiety disorder, and it's defined as the consistent failure to speak in specific situations where speaking is expected despite speaking in other situations. So it needs to have persisted for at least 1 month in a new setting, because we've got to allow for a settling in period first. It shouldn't be due to an unfamiliarity or discomfort of spoken language, for example, if English is an additional language. And it couldn't be better accounted for by another communication disorder, for example, a stammer or autism. It was originally written as a refusal, but that was thrown out of the medical dictionary in 1994. We no longer refer to this as a child refusing to speak. And actually, what people have been trying to do is change selective mutism to situational mutism, as this fits much better. The word selective implies that there is a choice, when actually there isn't a choice. The difficulty is actually related to the situation the child finds themselves in. So for ourselves, for diagnosis, what we're looking for is a consistent pattern of not talking to certain people in certain conditions, that the child doesn't speak even if it's clearly in their interest. We look for a sensation of freezing, which tends to be a blank facial expression, and that it can exist alongside other diagnoses, but it actually can't be better explained by them.